Hi, I recently wrote a blog about the different types of tests or investigations you might need to investigate your back pain or spine problem. The reason for that is I'm seeing a lot more self-funded patients who are concerned about hidden costs and not knowing what needs to be done to get to the root of their spine problem. So the traditional way of doing things, or a lot of other practices do, is you pay for an initial consultation and then a bunch of tests are requested, usually an MRI scan, which you then pay for. And then you have to have a follow-up consultation to go over the results of the scan, and then at that stage, formulate a management plan. Well, I wanted to do things a bit differently at the Spine MDT to get to the cause of the problem a bit more directly, and that's how we started our one-stop spine clinic. And the way this works is you have a free phone call where you can just get some basic information off you and find out from that what kind of tests you might need. And then there's a one price package where you pay for the test and the actual face-to-face or formal concise consultation thereafter, where in one consultation you've got the results of your test, and then we can formulate an actual management plan there and then. But the thing is, the majority of patients actually don't require an operation or any invasive procedure. The majority of our patients are managed non-operatively. And for that reason, not everyone actually needs an expensive test or scan. Quite often, we can get to the root of the problem just with a clinical assessment and physical examination alone. However, there are specific signs and symptoms in history that will determine if we need a scan and what type of scan we will need. Most of the time, that will be an MRI scan, which is shown here. It's a large magnetic tunnel that the body goes through, and it can give us quite detailed images of the spine, the vertebral bodies, the discs, the nerves, and so it's quite good at looking for areas of nerve compression. If there's suspicion of instability, in addition to the MRI scan, sometimes I may request plain x-rays, usually with you in the standing position, just to see the overall alignment of the spine. And then with you standing in various positions, such as flexion of the spine and extension, to see if there's any instability that we can see on the scan. If conditions such as osteoporosis or osteopenia are suspected, where the bones can be a bit more brittle or prone to fractures, then a test called a bone density scan, shown here, is quite useful at telling us the density of the bone and how prone you are or likely you are to having a fracture. And very rarely when we're considering surgery, for some types of operations where we need to put instrumentation into the spine, I might request a CT scan, which is shown here. It's a sort of donut shape X-ray machine that gives you nice cross-sectional images to get a more detailed view of the bones of the spine. And that's more for surgical planning than actual diagnosis. Another test I sometimes request is called nerve conduction studies, or EMGs, shown here, is where nerves are stimulated and then the recordings along those nerves are measured. This is sometimes useful where the MRI scan hasn't really shown a clear cause, or there's some doubt as to the cause of nerve pain that patients present with. This test can be quite useful. So please click the link below to read the full blog itself. I hope you find it useful. If you need to ask us anything or inquire about our packages of care that are one price, call us on the number below or email us, and I hope we can help you.